welcome to today's webinar hosted by TDS Health. We'll be taking a look at the TDS Health solutions for medical education. My name is Jenna. I'm a member of the TDS Health team. I support on our customer engagement team. So if you have stumbled on this webinar and you are a current client, you may have seen my face before. And if you have not purchased anything with TDS Health, I would be someone you would most likely connect with after purchasing to help with training, product review sessions, and getting content out to your different groups to support and make sure things get utilized. Um, like I said, today we're going to be focusing on medical education and more specifically undergraduate medical education. I do want to call out that if you are looking more for graduate medical education or if you're more focused in the undergraduate, almost like pre-health systems section, we do have content for both those areas as well in some of our products. But today we're going to be focusing predominantly on undergraduate medical school, so undergraduate medical education. I have a quick little list of topics for us to cover today on my handy dandy little agenda. You'll notice that we have the introduction and welcome, which we did. Again, my name is Jenna. I'm on our customer engagement team. And then we're going to take a look at a couple of different products that we offer for undergraduate medical education. So we see these products utilized in bundles or individually, depending on the needs of our clients. And so we're going to take a look at quite a few. On the right-hand side of the screen, you'll see that we've got a couple listed. We have StatPearls, Anatomy TV, EKGaction, as well as Ditki. So we're going to pop quickly into each of those products, discuss some of the key high-level details about them and how they relate to undergraduate medical education. If you are interested in getting a more robust and in detailed review of any of these products or a multiple set of these products, please feel free to connect with us. We are happy to set something up. This is really meant to be served as an introduction, just to give you an idea of what we have and see if it aligns with something that you may need or you may have a gap in currently within your curriculum. We're going to kick off today's session by looking at EKGaction. That is our newest product that's been added to the TDS Health suite. I've switched my screen over to my EKGaction account, and I'll give a little elevator pitch about each of these products as we go into them. But EKGaction was founded by a cardiologist by the name of Dr. Bill Chavone. And what he was seeing when he had residents coming in or medical students coming through rotations in cardio is that the level of understanding of EKGs varied tremendously. Some students had studied some, interpreted some, and were very familiar with EKGs as a whole, or others, maybe the first time they're seeing it or even hearing about it was in their clinic rotation. And so that drove him to create the EKGaction Suite, which is a collection of different programs designed to really give students that deep understanding of the EKG as a whole. We're going to focus predominantly in this introductory program, the EKG Learn It Well, here on the left-hand side, as this is really designed specifically for undergraduate medical students, as well as even first year or even second year residents. So that true foundational understanding of the EKG and then how it applies clinically. You'll notice on my screen, there's a couple of other programs in here. The advanced program is going to be more so for those who are practicing cardiologists or exploring and expanding into high-level fellowships. And then we have a couple that are more geared toward an allied health community, being that focus within EKG techs, EMTs, and then even chest x-rays. So if I open up the introductory program here, the Learn It Well program, you'll see that it's laid out similar to like a textbook. So you'll have a table of contents, an alphabetized index, a figures index, as well as the ability to look at the last 3 results from the quizzes and the cases that you've completed in here, which we'll take a look at. And so the way this is laid out is that you're able to move through this course chapter by chapter, taking different review questions and assessing your knowledge on the particular EKG topics, where at the end of the course itself, you will be met with a variety of different cases where you actually have the ability to look at and interpret an EKG based on the knowledge that you've learned throughout the course. So just to give you an idea as to what the course looks like, if we were to open up chapter 12, you'll see that we have that here. You've got your images, if there are any here in the center, with their corresponding figures as well as details. And you can move through this and study through the course itself. before hitting those cases at the end. This is a little review section of the chapter we were just taking a look at. And then you also have a quiz where you can go through and submit your answers on this quiz. And again, like I said, these scores are recorded where you can see how you did on the last couple of quizzes, but just moving through to show you how these quizzes look, answering them. Looks like we've got 6, so we'll move through them pretty quickly. And then we can submit our quiz and we'll be given scores as to how we did on that particular quiz and those quiz questions. So that's how the layout of the course will look throughout. In addition to the sections that are based out by chapters, like I had said, we have some cases. So after moving through the Learn It Well platform, you will have chapter 22, which is going to be made up predominantly of actual EKG cases where you are able to interpret them. So if we are to open them up, let's look at case number 1. You'll see that you have all the instruments present to be able to review and interpret the EKG. You'll also see that you have a notes section where you can take notes. And then down here is where you'll make those selections based on the interpretations and findings in the EKGs. So I'll make a couple of selections just so I can show you how that scoring system looks. And then once you submit, you'll get a couple of details. So you'll get a score in terms of how you did. It'll let you know which answers you selected correctly, which ones you selected incorrectly, and then which correct answers went unselected that you should have selected. So you get that interpretation as to where your selection should have been made within these cases. And then down here is a breakdown as to those areas as well. And then again, we can move through it. We'll have more and more cases that we're able to review and take a look at. Here are some of the learning points from that first case for us to be able to look back and make sure we have an understanding of these particular topics. Now, I am logged in as a student at this time, but I did want to call out that with the Learn It Well platform, there is an administrative side to this. So if you are an administrator wanting to look at the student's performance, see how they're doing, you are able to go in and take a look at those previous scores like we talked about for both those quizzes and those cases. You also have the ability to create your own cases. So if you wanted to add additional material in here, whether that be actual EKGs to be interpreted or even some quiz questions in the form of cases, you are able to do that. So there's a lot of flexibility with that within this resource. I'm going to quickly hop back over to my presentation and we're going to move into our next section of products we're going to take a look at, which is going to be products by the name of StatPearls and Ditki. Now, I have these two grouped together because they have some things in common, but they are very different products. So we'll go through those key differences and those similarities in each of them individually. I'm going to go ahead and start with StatPearls, which I've just switched my screen over. This is my StatPearls dashboard. And again, elevator pitch for StatPearls, their motto is content is king. So they really pride themselves on having a variety of different types of content and a lot of details for students to do true review and study for certification exams. And so some of the more inherently obvious pieces of StatPearls is going to be that question bank and the ability to build out quiz questions. That's over here on the left, where you'll see I've selected the USMLE Step 1. We also have the other USMLE pieces, shelf exams, and then even other specialties as well. And so from here, you're able to build out a quiz where you can determine the type of quiz you would like to take, whether that's in more of a study mode, or you can look at explanations as you go, or a test mode if you want to really truly simulate a test. And then you can make specifications in terms of difficulty level, topics, age range, different sciences. You can even search for keywords or phrases, or you can actually align your quizzes to a collection of peer-reviewed topic articles that StatPearls has, which we will cover in a little bit. For example's sake, I'm just going to do a quick little one question quiz just to show you all how that interface looks. And so I'm in that study review mode, so I am able to answer until I get this question correctly. And I will be given a teaching point detail down here about the particular elements of this question, why I was right or wrong, and some key takeaways. And then down here at the bottom, we actually have a link to a StatPearls topic article that we can open up. And we'll take a look at those on a separate screen when we look at the articles a bit later. But each question has a corresponding peer-reviewed article that you can go through and review, whether that's in a quiz, after a quiz, or even independently from the quizzes. So now that we've done our quick little one question quiz, I'm gonna hit next question, and that's where we've met the end of our quiz. You'll always be given this little scorecard where it'll tell you how you did, and then the quiz transcript is more of a detailed review of the quiz itself, where you can see what your question was, the related readings, the different systems, clinical science, difficulty levels. So all those different customization pieces we could select from. This will tell us what we were assessed on. Now, in addition to the question banks, if we go back to our user dashboard, it's going to take me back to my quizzes. But if I was to go to my home page, you'll notice I have this little search bar here in the middle. So there is also a point of care tool within StatPearls where you can make different searches for drugs, diseases, procedures, details like that. And then also we have this little tool section, which will include calculators, algorithms, drug interaction checkers, and all of those kind of tools. So the intention behind this is to have all these things in one place. So if you're studying for your certification exams, you can take questions, you can review articles, you can make searches and use it as a point of care tool. So kind of like a one-stop shop, everything in one place. Just wanting to show you a little bit about those articles. Over here on the left is the article section. So if I was to open this up, you'll notice it's an A to Z list of articles. I'm still focusing predominantly on the USMLE Step 1, but you can switch to different banks to get articles that correspond to different question sets. And then in here, you're able to review these different articles. You can open them up directly, review the article itself. You'll get details in terms of the author, the editor, and then all the content. And then if I quickly scroll down to the bottom, I do just want to point out for you all that we do have references with their PubMed ID that links directly, as well as a scoring system that'll tell you the level of evidence based of that particular reference if that's of interest to you. And that is the list of references here. So shifting gears from StatPearls, we're going to hop over to Ditki, which was previously known as Draw to Know It. Now, I want to cover where Ditki and StatPearls have some commonalities before I talk about their differences. And that's predominantly that Ditki also has some certification preparation material as well, but the delivery system is going to be different. So StatPearls, we took a look at question banks, a point of care tool, and then articles, where Ditki is going to be more of a multimodal learning platform. And so Ditki is designed by a neurologist by the name of Dr. Adam Fish. And his focus was creating a product that had true elements to make students actually remember the material they're learning. And so within Ditki, there are different delivery styles for every type of learner. So if you're an auditory learner, a visual learner, a kinetic learner, if you're someone who learns by assessments, all those pieces are going to be broken out into the Ditki product. That way you can really lean into what works for you to actually digest material. So all of that going into the idea of memory scaffolding to really build up the memory to be able to retain for long term. So with similarity with that certification element is on my page right now, you'll see I have access to all the different Ditki courses, so different subjects and different areas that you can focus on. But I want to point out down here on the bottom right, you see that we have a USMLE step 1, 2, 3, as well as COMLEX and some other certification pieces. So this is that area where that overlap happens, that if you wanted to reaffirm for a certification exam, you can focus predominantly on this material in Ditki. So if you'll see that I've opened the USMLE Step 1 section, and we've got a variety of different topic areas that we can go through, watch those tutorials, look at different flashcards, as well as taking questions to prepare for that certification exam. But Ditki is not necessarily entirely specialized just for the certification exam. So we do have those USMLE pieces and those different certification exams focus, but we also, on that dashboard that you might have seen, we've got a variety of other topic areas. So there's a couple of different pieces in here that are really popular for undergraduate medicine. Some of mine that I like to point out, other than the USMLE pieces, is clinical medicine, clinical pathology, clinical pharmacology, and embryology, and things like that, which you'll notice over here on the left-hand side. For example, I'm going to go out and open up clinical medicine. So from here, like you saw with the USMLE section I opened up, you've got a variety of different areas, almost like chapters that we can go into and select from. And so once we pick one, you'll see on the left-hand side, you've got a list of different tutorial offerings. And then on the right-hand side, you'll see up here, we've got some clinical scenario board review and some flashcards. So this layout is the same for each of the different courses and course sections. The content just changes depending on the topic. And so from here, we can open up one of these tutorials to take a look and see how those run. And I'll go ahead and play this and mute it.
Here we'll learn about it.
And what I want to point out specifically is that the tutorials, you'll notice we will fill up this screen, whether that's with a table, a structure with labels, or a combination of both. And this is intentional. This is something that Dr. Fish did intentionally when creating these tutorials, because what he was finding is that students are so frequently either watching really short visual videos where it's 30 seconds and you're having to rewatch it over and over to try and actually remember what's on the screen and digest it, or we're watching lecture, almost, lecture length types of content where the students are losing interest. And so you'll notice that the tutorials are in here anywhere from usually 2 to 3 minutes to maybe max about 15. And then you'll also notice as this plays, we're adding material to the tutorial video, but we're not losing anything. So nothing is going on the screen and then off the screen. We're building it section by section to take a really complex topic built out and then wrapping up at the end there. And that's intentional because it helps the student be able to see that full pathway as to how this complex topic can be broken out into those small areas. So in addition to the tutorial you have here, you've got a little notes section over here on the right-hand side with corresponding notes to the tutorial. You've also got details on the board relevance, transcripts, all those things that you can review and also take out. Up here at the top, you've got a quiz area where you're able to take quizzes that correspond to the particular tutorial you just watched, but I also wanted to point out the drawing pads. So you saw as we watched that tutorial, we had those tables and those figures that we're building out. Well, we could go into our drawing pad and we could draw along with that video. We could get the starter image of what that video started with, or even the diagram at the very end, where we can go through and actually add the labels to this diagram, or we could draw on it and we could give ourselves some knowledge there and draw out these actual structures depending on what we need. So, like I said, having a variety of different types of tools to be able to provide a multimodal learning environment so different students who learn in different ways feel supported with something for them, or if they want to teach themselves with multiple types of learning technology, which we see helps with retaining memory of content, they have it all in one place instead of having to seek out other areas. Um, that is the main rundown of Ditki as a whole. I did want to call out some of the administrator pieces and details of Ditki that are of interest. Ditki allows the ability to do some custom course creation. And so how that would work is if you have a faculty member who would like to use Ditki, you've got a variety of different courses, and they'd like to build something custom to align with the course that they're delivering. Ditki can take a look at a syllabus, a lesson plan, the length of a course, and actually build you a custom course. So on my screen here in the center, you'll see this pathophysiology in nursing practice, as well as this upper extremity one. These are both custom courses for a nurse practitioner program and an occupational therapy program, but the same practice applies here is where their faculty gave us an idea as to what they wanted to cover, the different topics of interest, the length of the course itself, and then the Ditki team was able to build out a custom course for them. That way they could give that custom course to students and have them follow along and complete the necessary details that they need throughout the course. Administrators can then look at the performance of students, how much time they're spending in here, and then also the quiz questions. If you are an institution that lives heavily in your LMS system, whether that's Canvas, Blackboard, D2L, Ditki does have an embeddable functionality. So we don't have a grade pushback or passback at this time, but you can embed those tutorial videos, flashcards, all of those details can be embedded into your LMS system if you'd like to have them in one central place. Even though we don't have a grade pass back, all of the questions within the quizzes can actually be downloaded in a CSV file with their answers. So you could create the quiz questions yourselves from the content. We just don't have the functionality right now where it directly reports back for you. And so let's move on from Ditki to our last product, which is going to be Anatomy TV. But to give a quick reminder of what we've covered so far, we took a look at the Learn It Well course within EKGaction, focusing on the foundation and fundamentals of interpreting EKGs. StatPearls, which serves as a question bank, point of care, and then peer-reviewed article library tool, where you're able to teach and learn in different ways depending on what you prefer in here to apply to that certification exam, or independently if you're doing research and review. We have the multimodal platform known as Ditki that we took a look at, which has different tutorials, flashcards, drawing pads, quiz questions, both for certification and also for a variety of different course topics. And then our last product we're going to take a look at is called Anatomy TV, powered by Primal Pictures. And this product is going to be exactly as it sounds. It's focused predominantly in terms of anatomical content, but there's a lot more in here than just what you think of when you think of anatomy. So Anatomy TV, powered by Primal Pictures. Primal Pictures is a UK-based company, and they've got a variety of different things that they really pride themselves on, but the key one would be medical accuracy. So all of these modules that we're going to look at, the models, have been built off of real scan data versus being artistically rendered. So they really pride themselves on their accuracy, aligning to actual real scan human cadavers. On my page, we are logged into my Anatomy TV platform, and Anatomy TV has a variety of different modules depending on the type of content you want to look at, as well as the focus areas. So different clinical specialties and different delivery of an anatomical content based on your need. I like to show this welcome page because it breaks out some of the different types of content that we have in here. So you'll see that we have 3D models, dissections, imaging, clinical applications. So with injury or conditions, how that applies anatomically. We've got physiology, so looking at the microanatomy, muscle function, looking at overall movement and seeing how that works, as well as some guided learning and assessment if you're trying to do more of some assessment of different structures to know where they are, what they are, and all of those good things. So there's a lot of components to Anatomy TV that we could take a look at, but I do want to focus predominantly on some of the newer releases with Anatomy TV that relate to undergraduate medicine. To start, we're going to take a look at this first top card here that says Anatomy Learning Outcomes for Medicine. And so this was a recent release in collaboration with the Anatomical Society to build out these learning outcome lectures for medical school students. So directly applying to those in medical school and the expectation of anatomical concepts they have to know and have to learn while they're in medical school. And so you'll notice when I scroll down that we've got a variety of different sections, different topics that we can review, as well as a corresponding lecturer who actually provides a lecture video about that particular topic that we take a look at. And so if I was to hit start on one of these lectures, I'll go ahead and play this and mute it. You'll see that the lecture up here is Dr. Stiver reviewing material utilizing the Anatomy TV platform and the variety of different modules within. And so you have the ability as a student to watch this lecture about this particular topic. If we scroll down a little, you'll see each of these different sections takes you to a particular area that they're covering within the tutorial itself. And then we have additional content, whether that be another model you can interpret, a slide, an image, a CT scan. And so these are different areas that you can move through and review about that particular topic that we just covered in the learning outcome itself. And so each of these are designed to really give like a reinforcing element for that lecture as a way to cover a particular topic, whether that's reinforcing in preparation for a lecture for faculty, something that they have students do after it's presented in class, or something that maybe the syllabus isn't going to allow enough time to get as detailed of a review, and you want it to be something the students do on their own time. So completely up to the lecturer and the curriculum developed for that particular faculty member to use this how they would like. I do want to call out that these can be embedded directly into your LMS system. So whether that is Canvas, Blackboard, D2L, so you can actually embed this particular lecture and then the corresponding additional material directly in there for your students to review if you'd like to. There also are sharing features where you can utilize a copy link tool to send this material back and forth as well. In addition to the medical learning outcomes, another newer release that we're seeing really popular with undergraduate medical students is going to be one within what's called the 3D real-time suite. And so if I scroll down, you'll see that we have this section here that says 3D real-time. When you think of 3D real-time with Anatomy TV, it is a virtual dissection tool. So this is really where you can make completely custom views of different structures and areas of the body depending on what you're wanting to see. So you can pick and choose every single layer in here and make selections based on what you want to see. And so you'll see that we have all the different areas of the body as well as a whole body, and the most recent addition being embryology. So embryology specifically, go ahead and share that. This was designed utilizing the Carnegie slides. And so what you'll see in here is that I have mine set to days, but you can also switch this to stages to review. And you'll have the model here in the center where you're able to make selections based on individual stages. You can also use structural development. So if you wanted to look specifically, let's say at the epiblast and its derivatives, I wanted to compare 17 to 19 days to 19 to 21. I can make those selections. And then from there, I can go in and I can inspect certain structures in space. I can examine them almost like an X-ray format. I can ghost to look behind them. I can hide them completely and just dissect them off the model. And so you have that full functionality in here to isolate out particular structures and then really build out a model exactly the way you would like. So we've got some preset views over here on the left, like I said, with structural development or the individual stages that you can use. But on the right-hand side, you can also open up by day or, like I said, by stage, and you can pick individual structures you want to add in and make this completely custom depending on what you want to see. Um, as someone who took embryology, this is a lot easier than the claymation videos I was watching to be able to see how these actual derivatives move and bend as they go into that development stage. Um, in addition to being able to make the views completely custom and exactly what you would like, you can also mock these up. So let's say that this structure view I have right here of days 51 to 53 on my left and then 53 to 54 on my right. This is the view I want to use. I then can use these little functions to add labels. I can add pins. I can add text boxes. I can draw circles and write on here arrows. So you really can mock this up however you like, whether it's something you want to make for an assessment where you have students label certain things and you say, what is structure A, what is structure B? If you're writing notes on here as something you want to remember, you can completely customize these and then also share them in the form of a still image or using that copy link tool to where you can send them to students back and forth. They also can send them to each other. So we see people utilize that in a group project scenario as well. And like I said, there's a variety of other modules within Anatomy TV that we could take a look at, but I want to be cognizant of time and focus predominantly on the new releases that we have seen. But in addition to the medical learning outcomes as well as the real-time embryology, we also have content specific for functional material. We also have clinical specialties. We have a section called diseases and conditions, which focuses on pathology and actual injuries. So the medical learning outcomes pulls a lot of that material from different modules and delivers it in the actual lecture. And so having a suite of all of those together really provides a really robust and well-rounded type of way to be able to review all the anatomy. That is the end of my presentation on the products specifically. So we took a look at quite a bit today. I know it's a lot of information, and like I said, this is meant to be really a general review and introduction. If you want to learn more about these products, if you're a current client, we're happy to set up a product review session to make sure your teams are up to speed on what they have and they're aware of all the support tools within there and the ways they can use it. And if you are not a current client, and we would love you to be, and you want to learn more about one of these or multiple of these, or if you'd like us to build out some custom packaging for you, we're more than happy to connect and would love to meet with you to discuss that. Um, the last little point, if you are watching this after November 1st through 5th, you can disregard, but we will be attending a conference. We'll be attending AMC. That'll be in San Antonio. My colleague Catherine will be attending that conference. So if you have students who are attending that, or if you yourself are attending, please feel free to pop by our booth, talk about any of these products with us. We would love to give you any information you may need. And we look forward to hopefully working with you in the future. Like I said, my name's Jenna. I'm on the customer engagement team, and I very much appreciate you taking the time to watch this presentation. Have a good day. Thank you. Bye.